This program has been made possible in part by the following sponsors. The Trial Lawyers Association of BC. The Vancouver Courier newspaper. My new book about addictions, All the Way Home, Building Recovery That Works. About 6 years ago, knowing that I was having an angina attack or episode at 1:15 in the morning, I quickly changed clothes, put together a little toiletry kit, and dialed 911. It's a good thing I did those other things first, because within 5 minutes, I had 8 big, handsome, hunky guys in my kitchen. So if you're ever lonely, that's the number. That's the number to dial. Forget Craigslist. But did we really need all these people? And did we really? I mean, it was wonderful. And, 5 days later, after an operation, as I was swimming in the aquatic center pool, I was very grateful for all of this. But in terms of planning, does it make a lot of sense? Cameron EBY is the recording secretary for the Ambulance Paramedics of BC. CUPE Local 873, and here he is, without an oxygen tent or anything.
Yeah. That's right.
Yeah, Cameron, great to see you. Well,
Thank you for having me.
So many headlines in the last week and a half about this issue. My understanding is that your organization has changed the way you're operating, and that's affected arrival times. Is that correct?
So what occurred in the fall of 2013 is that BC Ambulance Service changed what they call their resource allocation plan, and that's essentially a matrix that determines how the ambulance and other first responders respond to various situations. And so they changed a number of calls from one level of priority to another.
Yes.
And so since that time, there's been various amounts of feedback from different municipalities, different first responder agencies on the impacts of those changes.
Okay, before we get to how Metro Vancouver Metro mayors are reacting to this, because they're all reacting a little differently, why did you make the change? What was behind the change? Why did you have to move resources around?
Right, so first of all, it wasn't us. It wasn't the Ambulance Paramedics of BC. We represent the paramedics and dispatchers that are doing the work.
Yes.
It was the BC Ambulance Service or BC Emergency Health Services. And what we're told for the reason for the change was that they needed to better prioritize which calls are getting an emergency response with lights and sirens and which ones aren't, with a goal of reducing response times on the most urgent of calls.
Of course.
And the secondary factor that they've told us it was about is every time an emergency vehicle drives through the streets, there's an inherent risk of doing that with the lights and sirens on. And so they want to make sure that they're not doing that unnecessarily.
What's the difference, just out of curiosity, between having the cherry lights doing this and having the cherry lights and the siren?
Well, we either have all the emergency equipment, and lights and siren, or none at all. So, yeah, and so we are, and that's by law. And so when you're driving with the emergency equipment on, there's certain rules of the road that you can get around.
So I'm just hallucinating that I've never actually seen an emergency vehicle just with the lights?
You may have seen it, but by policy, that's not supposed to happen.
Okay. So it strikes me reading the material that the underlying reason for a shift in allocation is money. And I get the sense, and correct me if I'm wrong, but I get the sense from the reports that I'm reading in the press, A, this is a provincial issue, and B, we're not funding ambulances to the degree that we should.
Right, and from our point of view, we would agree with you that the it seems to us that, at least in part, these changes are aimed at trying to shuffle what little resources we have to try to improve response times for some calls at the expense of others, when the underlying issue is that we don't have enough paramedic resources, and that goes for virtually every community in the province.
Under which umbrella do you fall? Is this a health? Is this a transportation? What is this?
Right, so the BC Emergency Health Services is a division of the Ministry of Health.
Aha.
Yeah.
And the Ministry of Health, in its wisdom, for some reason or other, is just not giving enough money to this service.
Well, it's certainly, we haven't seen the growth that we think is required to keep up with response times as the population has both increased and aged. There's two different factors.
Absolutely.
We're seeing the call volume go up, but we haven't had a significant increase in resources in that time.
Okay, so people who work in the ambulance service have a certain kind of training, yes?
Paramedics, yes.
Yeah, and just a quick description of the training. How long does it take? How arduous is it?
Right. So there's two main divisions. We have dispatchers.
Yes.
And we have paramedics.
Right.
And so our dispatchers are the people that receive your emergency 911 call when you specify ambulance is what you're looking for. And they use a protocol. They have training, and they use a protocol to assess the calls, and based on the information they're given, to assess a priority call. And so that's sort of their world.
It must be quite daunting, because probably people are often hysterical.
Absolutely. I did the job myself for 3.5 years as a dispatcher, and it's, you never know what's going to be on the other end of the phone. So it's a very challenging environment, and they do their best to triage those calls using the protocol provided to them, and then they assign those codes, which are then used to determine exactly which paramedic resources are going to be sent, along with any other agencies, whether it's fire department, police, search and rescue, whatever, Coast Guard, whichever it might be.
Yeah.
So, and the paramedics, we have several different levels of paramedics throughout the province. The first level, just below sort of a paramedic level, is called an emergency medical responder. And then the next level is the primary care paramedic, which is what we consider the baseline for the province. Above that is advanced care paramedic, which are found in select communities. And there are cardiac and respiratory sort of specialist units. And then beyond that, we have two specialty teams, which one of them is critical care paramedics.
Yes.
And they are essentially critical care paramedics that specialize in bringing the ICU out to various areas of the province.
And this would be in the case of major auto accidents or fires or
they do
something catastrophic.
Right, and they do scene responses like that, but a lot of their work is focused on inter-hospital transfers. So they'll go and receive a patient from an outlying community,
and
bringing a high level of care, and bring them back to a higher level of care. Yeah. So, and then our other specialty team is called infant transport team paramedics, and they specialize in neonatal and maternity patients specifically for that population.
Yeah, I just want to tell you before we go on with this that I've had to call 911 3 times in my life. Once for myself, once for my mother, may she rest in peace, and once for a funny old man that I used to visit every week for tea. And I will tell you that every one of these 3 calls, the response has been beyond perfect. It's been fast. The guys are calm, they're knowledgeable, they are reassuring, they cool the situation out, they assess it just rapid fire what the scene is, and they deal with it exactly as they should. I mean, it's really been a remarkable experience for me.
Well, thank you. I'm glad to hear that you had those experiences, because often we're coming into people's lives in a moment of turmoil, and the reality is that our paramedics are trained medical professionals, and we like to think that they're delivering an excellent product when they can get there. We'll
come back to when they can get there. How often is there rebooting of training? Is that a regular, ongoing sort of thing?
Yes, it's an ongoing thing. It's called continuing medical education. So every paramedic in the province is required to achieve a certain amount of continuing medical education every year to maintain their certification.
Yeah, good. Okay, so now we don't have enough. Can you just, this is a bit of a frivolous question, but just off the top of your head, could you say how many more paramedics you think should be working today rather than the number you have?
Well, I can tell you for the Lower Mainland.
Yes, tell me.
We did a research study. We hired a consultant to review the actual response data.
Yes.
And our figures showed that for the Lower Mainland to hit what are considered the national standard for response times for urgent calls, we need 22 more full-time, 24-hour-a-day ambulances staffed with paramedics.
22 more vehicles staffed.
Right.
So that, what is that? Is that 66 more people or 88 more people? Or?
Well, one 24-hour ambulance to maintain scheduling 7 days a week requires 8 paramedics.
Ouch, that's a lot of people.
So
but even so, it's less than 200 people.
Yes.
Okay, so you're saying if this afternoon Minister Lake said, baby, we love you, here's 180 fresh bods, go crazy, you'd be pretty happy.
Oh, absolutely. We'd be ecstatic. And that would make a huge difference in response times, and that's just for the Lower Mainland. And it would make a huge dent. And we've also got some other issues with how paramedics arrive at hospitals, and do they have a hospital bed to deliver the patient in? And often we end up waiting at the hospital. So there's also an issue sort of on the back end of a call as well. And
Let me check out a bit of public mythology before we go to our little break. Because I've had such good experience myself, I've told friends of mine, if you ever have an emergency, do not walk into ER yourself, do not take a taxi, do not have your partner drive you. Call 911 because you're going to get served. Now, maybe that's just because I was a heart patient.
Yeah.
Is that because I was a heart patient?
No, I think that's good advice.
Yes.
That you know, when you're having a medical emergency, you want somebody to come to you rather than the other way around. There is a bit of a mythology about if I arrive at an emergency department in an ambulance, I'm going to get in faster. That's not the case.
It's not the case?
You get triaged the same as everybody else. But the difference is that we can provide medical care, health care, you know, in your home or your car or wherever you happen to be.
And in the ambulance.
And in the ambulance.
Because when I went, I was loaded with stuff. I was all wired up. And,
exactly. And sometimes
dripped up and so on,
And sometimes that can be a life-saving intervention that happens that you're not going to get if you're in a taxi.
Yeah, no, I survived. The guy helping me died. No, I'm just kidding. Okay, we're going to take a break. He died because I was telling him jokes.
Yeah.
We're going to take a little break, Cameron, and when we come back, let's talk about what the mayors are doing across the Lower Mainland and how the firefighters are having this extra load placed on them, because that may or may not be fair to anybody. Absolutely. Starting with them. Okay, we'll take a little break. Cameron Eby is our guest from the Ambulance Paramedics of BC. And we just want to pause, give you a chance to send us an email or hello to davidberner.com, and the opportunity for the lovely people who support us here on this program to say hi on Shaw Community Television, Cable 4. Back in a sec. This program has been made possible in part by the following sponsors. The Trial Lawyers Association of BC. The Vancouver Courier newspaper. My new book about addictions, All the Way Home, Building Recovery That Works. Who is it that you want responding to an emergency? Is it a firefighter or an ambulance attendant? It depends what the emergency is, I suppose. Cameron Eby is the recording secretary for the Ambulance Paramedics of BC, which is a CUPE organization. So now, what's happened, I get the impression that firefighters have picked up a lot of the slack when we don't have enough paramedics on the road. Is that correct?
Well, what's occurred is that calls that both agencies historically responded to with lights and sirens.
Yes.
Some of those calls have been downgraded to a non-lights and sirens response for paramedics.
Yes.
Some first responder agencies have decided to continue responding to those emergencies in a lights and sirens fashion, or sometimes not. What BC Ambulance has said is that according to their research on about 600,000 calls that they reviewed over, I believe, 2012,
yes,
is that first responders were not required in those situations. However, some of these agencies have decided to continue responding. And because the ambulance is not coming lights and sirens behind them, they're now experiencing a longer period of time from their arrival to when the ambulance arrives, which translates into them being tied up and busier longer.
And time is of the essence. Time is everything. That's what this game is about.
Absolutely.
Yeah. So a colleague of yours, Josh Henshaw, wrote an excellent, this is what got my attention to this story, but the story has gone on and on with one story after another in recent weeks. But your colleague, Mr. Henshaw, wrote an excellent letter to the editor, and he said, Lower Mainland Local Governments Association correctly identifies shortage of paramedic-staffed ambulances in the Lower Mainland, but they unnecessarily burden the taxpayer by trying to use fire services to fill the gap. Fire-based emergency medical costs Lower Mainland municipalities over $120 million a year. He says for 1/5 of the cost, we at ambulance paramedics could be handling that.
That's right.
Is he right?
Yes, he is. Yeah, it's a pretty staggering number.
Yes.
And the reality is that the paramedics who are working through the BC Ambulance Service are the medical professionals in the field, and they're the ones trained at the various levels we discussed to deliver those services. The fire departments are operating at a first responder level, and one of the proposals from Delta is to train them, at least for a temporary period, up to an EMR level.
Well, Mayor Jackson has always marched to her own drum. She's the one of the many mayors who said, okay, I'll just train the firefighters more.
Right.
Nobody else has said that.
Right.
Yeah.
And, well, actually, one other community has done that historically, and that's Prince George. And they did a trial where they trained their firefighters to emergency medical responder level, and they were deployed in that manner for a period of time.
And then?
And at the end of the specified trial, all the results that we've been made privy to showed that there was no impact on patient care by doing that. So an EMR is what it's referred to. An EMR level gives them a few more diagnostic tools and to assess things like blood sugar and a few other things. But they are not at the level of a paramedic. And so,
they're not?
No. And so it's still our position that you know, the baseline for the province should be paramedic level, a primary care paramedic.
The reporter who's covered this story repeatedly, Kelly Sinoski, says in plain English, these folks are underfunded.
Yeah.
That's simple.
Yeah.
So does one get a hearing with Minister Lake? Does one get a hearing with this government? Is there an open door here? Is there a place for a conversation?
I think there is, yeah. Yes. We've had an opportunity to speak with the Minister of Health on a few different occasions, and we've got some ideas about how we could, in the short term, add some more resources that would allow a trained paramedic to get on the scene sooner. But we've got some larger ideas about how we can start to develop a different look at healthcare and stop some of those 911 calls from happening in the first place. So that's something called community paramedicine. And so this is something that's being used in lots of jurisdictions, other provinces in Canada. And it's about kind of thinking of it as getting back to doing house calls. Where back in the day when the doctor used to come to your house and start delivering those things there. Well, they're using paramedics to do some of those services in communities. And in large centers where there's an extreme call volume and the hospitals are overloaded, when we can get out in the community and deliver those services before they have an emergency, whether it's to the homeless population or to the seniors population, whatever it might be, you can prevent them from dialing 911. And there's not only huge savings as far as resources, but the financial savings without people going to emergency departments.
Well, this fits in. I mentioned it with another guest a week or so ago. This fits in with the new modern thinking called upstream, thinking before someone falls in the river. Let's deal with them before they fall in the river.
That's what it's all about.
Yeah, and what did you call this? Community paramedics?
Community paramedicine.
Yeah, I love it. I think that's great.
Yeah, it's very successful elsewhere. So that's what we see as part of the solution.
Okay.
That's not to undermine the issue that we have a very serious issue with the amount of resources in most cities around the province. And so we do need more paramedics. There's no getting around that. But what piece of the puzzle there's going to be, you're going to have to piece everything together to try to solve this issue. It's not just one thing that'll do it.
Yeah, well, I've always chosen to not be in government. I've had the opportunity, and I've always resisted it. Yeah. So it's fun for me to sit on the sidelines and take pot shots. But I am rather simplistic in my thinking, or maybe I'm just simple in my thinking, which is we need more ambulance guys and girls. Let's hire them. Isn't that basically what our taxes are for? Fire, police, sewers, all the basics. We have a lot of frills in our government spending, a lot of stuff that is questionable. I don't think ambulance attendants are questionable.
Right, paramedics are they're a key part of that solution, and that's what Josh was getting at in his article. Is that when we have a shortage of paramedics, the solution for a shortage of paramedics is not to use municipal tax dollars to train firefighters closer to a paramedic level, or it's been shown that fire-based medical services like that are the most expensive way to deliver those services.
And you have none other than Mr. Corrigan, the Burnaby mayor, agreeing with you. He says our costs of firefighting are soaring, are going way up. It's not because we have more fires.
Right. Yeah, most fire departments, the majority of their responses are to medical assists to the ambulance service, and so it's a huge part of their work. And that's not to downplay the role that fire departments or first responders have in a medical emergency. They're a critical part of the team in certain calls like CPR.
Absolutely.
Or car accidents.
Yes, yeah.
Hazmat, all that kind of stuff.
Yeah.
But there is a larger section of these medical calls that we go to where the proper resource is a paramedic.
Surrey Fire Chief Len Garris estimates firefighters respond to 50 to 70% of all calls. Well, that's ridiculous.
I think what that quote was meant to say is that 50 to 70% of their calls are medical, that they respond to are medical.
Yes.
There is a large portion of calls that the fire department does not respond to, essentially the ones that are non-lights and sirens.
How do you see this at the present as an occupation? Are you having people rushing to you? Are you having youngsters, young men and women saying, hey, this is a good thing, I'd love to do this?
Well, that's the issue that's presenting itself in rural BC, because sort of the career stream for a paramedic in British Columbia is that you get hired into a rural community, and you have to work on call, and you get paid on call, so you only get paid when you get a call. The rest of the time you get a stipend, or that's where the $2 an hour
that's
comes
called
from.
a ham sandwich,
and you have to spend a number of years doing that to sort of climb your way up, and then once you get to the full-time salaried position, you end up in the Lower Mainland. And so now, because those jobs just don't exist out in rural BC, we're having a lot of difficulty staffing ambulances with paramedics out in those communities.
Do you have any affiliation with Vancouver Community College or with BCIT, the schools the first schools that we think of in terms of this kind of work?
Right. So
non-academic work?
There are a couple of schools in BC that are offering primary care paramedic. The primary paramedic education institute in BC is the Justice Institute, which is in Westminster. They also have campuses throughout the province as well.
But not yet part of these other colleges.
No.
That's a shame. It would seem to me that would be part of the story.
Right, and we often get asked, is it that there aren't enough paramedics to fill the jobs?
Yeah.
there are enough students, there are enough people going to school to be a paramedic. It's just that there aren't enough jobs within the ambulance service that actually pay you on the other end of that. So those students are going to another province, or they're going to the oil sector to work in the industrial sector. Because, you know, working in a small town BC for $2 an hour, or working in the oil field for significantly more.
A year to own a house.
That's
so real.
It's a real challenge for the ambulance service.
And are you telling me that we are at the low end compared to other provinces? Are you telling me that other provinces are doing better in this regard?
Most provinces are doing better, and part of that is wages, but a huge part of it is just providing the jobs that actually pay you to be there. Is the old sort of volunteer on-call model is just not working anymore.
And finally, we're almost out of time. What's your sense among your colleagues? Everybody's still happy to get up in the morning or in the evening and go to work? People like their work?
Well, I think our paramedics and dispatchers, they all got into it for a reason. They love their job. They love to help people. And, you know, they want to be there when people dial 911.
It must be tremendously rewarding, I would think.
Absolutely. I've been doing it for 15 years, and it's a tremendous career. And we have people out there working day and night, and we're extremely proud of them.
Good stuff, buddy. I like it. I like it. Thanks. Thanks so much. I hope you get some more money. And if you do, give me some. Next week, the municipal elections are fast upon us, and I know that Shaw will be covering them with all kinds of candidates' visits, but not to this show. Instead, Mario Canseco, the Vice President of Insights West, the polling company, will be here to tell us what you and I have been thinking about municipal elections and what we want our politicians to do and to be. Thanks for being with us. Delightful to have you here on Shaw, Community Television Cable 4. Good night.